My name's Renee Stone and I'm a lecturer at Griffith University in the School of Nursing and Midwifery. Today I would like to demonstrate one of several clinical skills modules. Of each of these modules, there will be several learning outcomes achieved. The first one will be knowledge, so you need to be able to identify and explain the medication or the fluid and its indication for use. Two will be values, so you should always be demonstrating a patient-centred care approach. You should always be communicating respectfully in a professional manner. And three is skills. So you need to be able to carry out the skill in a safe and logical sequence. I hope you enjoy these clinical skills podcasts. Thank you.
Before we commence, we'll need a patient medication chart with a legally written order. Now that we have a medication order, we are required to follow the minimum 6 rights to patient medication administration. 1. Person, so make sure you check the UR band on the patient. The right medication, is it indicated for this patient? The right dose, check your MIMS to see if it is the correct dosage. The right route, is it IV, IM, oral? Check this, is it correct? The right time, has it already been given or is it due now? And documentation, make sure you sign the medication and get it countersigned if required. Once you have identified the medication that you require, you need to look at the MIMS and the IV Injectables Handbook. In the MIMS, you'll be looking at dosage, indication, side effects, contraindications, and drug interactions. You should then go to the IV Injectables Handbook. Firstly, you need to find the correct medication page. This is located with the drug at the top. You then need to look at how to prepare the medication. Importantly, you need to look at the correct concentration for the medication, especially if it's in the lower increments, for example 500 or 700 milligrams. You need to note the time to deliver the medication, and you also need to ensure that the fluids being used are compatible. Before we commence this clinical skill, you'll be required to follow the 5 moments of hand hygiene. 1. Before touching a patient. 2. Before a procedure. 3. After a procedure or body fluid exposure risk. 4. After touching a patient. 5. After touching a patient's surroundings. As part of the 5 moments for hand hygiene, you'll be required to wash your hands as demonstrated. You will now be required to gather your equipment. You may need hand sanitizer, You'll need a 10 ml syringe for your flush, pre. You'll need normal saline for your flush. You'll need an 18 gauge drawing up needle. You'll then need a post flush of a 10 ml syringe, another 10 ml of normal saline, and an 18 gauge drawing up needle. You'll also be required some normal saline labels. You'll then need a 10 ml syringe for the medication and water for injection for the particular medication you're using. You'll also need an 18 gauge drawing up needle, a vial access cannula for the antibiotic that we're using, and of course the medication powder. In this instance, it's ceftriaxone 1 gram, and a medication label. You'll also need some alcohol wipes and a kidney dish to keep everything in to take to the bedside. Now we are ready to draw up the medication. We may use hand sanitizer or wash our hands. First, we will prepare our normal saline flush. So we'll grab our normal saline and take the cap off. We will then need our 10 ml syringe. And our 18 gauge blunt drawing up needle. When drawing up the normal saline, ensure that you do not touch the end of the normal saline container or the barrel of the syringe. You are able to then recap the normal saline syringe carefully, or if your facility has another cap device, then this is preferable also. You will label always the normal saline and place this in your kidney dish. The second flush is the post normal saline flush. So again, removing the cap, getting your 10 ml syringe, and 18 gauge blunt drawing up needle. Again, you'll need to safely draw up the 10 ml saline without contaminating the saline container or the barrel of the syringe. Again, once you've done this, you'll need to relabel with the normal saline sticker. And make sure removing all air from the syringe. Chasing up the needle with the cap. And placing this in a kidney dish with the other saline flush. So now you have your pre and post normal saline flush. It's now time to prepare your medication. In this case, it's the ceftriaxone 1 gram. You have your ceftriaxone medication label there. You need to remove the cap from the ceftriaxone. You may also want to wipe the top of the ceftriaxone, again as per local hospital policy. You have your water for injection in this case. Always refer back to your IV injectables handbook as to the correct solution for diluting your medication. You have your 10 ml syringe for this particular medication and your 18 gauge blunt drawing up needle. Again, the same process as drawing up your saline. You need to ensure that you safely draw up the water for injection without contaminating the vial or the barrel of the syringe. Always refer to the IV injectables handbook as to the correct dosage, whether it's 10 mils or whether it's 9.7 mils, especially if you've got increments, for example, 500 milligrams or 700 milligrams of ceftriaxone. You can then dispose safely of your blunt 18 gauge drawing up needle and put a vial access cannula on. The end of the vial access cannula has a sharp tip to pierce the end of the ceftriaxone. Push all of the medication or as much of the solution into the medication to dilute this. Gently shake it until it's all dissolved. Once you can see that all the medication is dissolved, you can then draw up the medication, ensuring that you get all of this solution into your syringe. Dispel any air from the syringe and make sure you've got the correct amount. Placing the cap back on and labelling correctly. Always get this checked by another nurse before going to the bedside, along with the medication chart. Put all your contents into your kidney dish, along with an alcohol wipe to take to the patient's bedside. Before administering any medication or IV fluid, you are required to follow the 6 rights. This involves checking the patient armband and asking them their name and date of birth, and again checking the medication chart. Now that you have all your equipment, it's time to administer the medication. You will take your medication to the bedside and you need to assess the IV cannula site for any infiltration, extravasation, phlebitis, or cellulitis. You will then use your alcohol wipe on the tip of the IV cannula. As per local policy recommendations, you may let this dry. It's then time to administer the normal saline flush, removing the cap and this can be delivered over a 3 to 5 minute slow push. Again, technique as per local policy. Always ensuring that the patient is comfortable at all times. It's now time to administer the medication. Checking again the medication, that you've got the correct medication, and checking the medication label. Removing the cap from the syringe. And firmly placing on the cannula. Always assessing the site and asking the patient if they're comfortable at all times. As per medication in the IV Injectables Handbook, for this particular medication, it's over 3 to 5 minutes of a slow push. Now that all the medication has been administered, you can remove the syringe and do the final flush. Again, another 10 ml normal saline flush, or as per local policy. Now that you've finished the flush, you need to dispose of all your equipment safely. You will then need to sign, and it may need countersigning as per local hospital policies of the medication chart. I hope you enjoy this clinical skills video. Just to recap, remember to follow these learning outcomes to successfully complete this clinical skills. Thank you.